My name is Sally Bradshaw. I'm a physiotherapist currently in the HARP Rapid Response Service for a 6-month secondment, but I've spent the last 21 years in the emergency department as part of the allied health team there. The health challenge that I'm hoping to solve is the problem of vertigo and dizzy patients that present to the emergency department. They're traditionally a challenging presentation to manage. They use a lot of resources, they take a lot of time, and one particular group of those presentations are a condition called BPPV, benign paroxysmal positional vertigo, which is a mouthful of a name, but if you speak to a family member, a friend, somebody's going to say, "Oh, that's those crystals in my ear that the GP said I just have to do this little thing." So it's a condition that's common as people get older. If it's untreated, it can result in falls. It can be treated really easily at the bedside in the emergency department by doctors and physios. But what I've seen over the last 20 years is that it's just not. And so people aren't getting evidence-based care. They're not getting the best care that we could provide for them. And so I'm hoping we can improve that. The research involves 2 parts. The first part is an audit where we looked back at 6 months worth of presentations to the emergency department. So all of the patients who presented with symptoms of vertigo and dizziness. We looked at were patients receiving the recommended assessment and treatment practices for BPPV, and also looking at is there a difference between medical and physiotherapy staff. So if a patient was seen by a physio, were they more or less likely to receive that recommended treatment? We interviewed 13 ED doctors and 13 ED physios to understand why they do what they do. So trying to get a sense of why the practice occurs or why the practice doesn't occur. With the audit, we found out that approximately half of the patients who present with symptoms of BPPV receive the recommended treatment. And when we looked at the interviews with staff, that was really interesting to understand why patients do or don't get treatment. And a big part of that was it's a really tricky, challenging, time-consuming presentation. And emergency departments are really busy, dynamic departments with a dozen patients that people are managing at any one time. Patients were more likely to receive recommended care if they were seen by the physio than if they were just seen by the doctor. And so now we understand why that is. Well, if you've got a group that has that expertise and those skills, why don't you use it? The problem is after hours when physio's not there 24/7 and the doctors are and patients are. So our next challenge will be what do we do in those after hours times? Long term, I hope this research will mean that patients who present to the emergency department with symptoms of BPPV will receive prompt treatment and will be better educated on what the condition is, and staff will feel more confident and more supported to be able to provide the recommended care.